So our first plenary speaker is Professor Alison Moore. She's going to be talking about diverse approaches to support healthy aging. She's the new director of the Stein Institute for Research on Aging and Center for Healthy Aging. She brings a lot of clinical expertise as well as forward-looking ideas on what we could do in the community. So, Alison.
Thank you, Ramesh. It's a great pleasure to be here today. We also have the privilege of having Ramesh on our steering committee for the Stein Institute for Research on Aging, which has been extremely good for us. So I have the privilege of also being Chief of Geriatrics, Gerontology, and Palliative Care here. And as Ramesh says, I use my clinical lens to interact with others in their research projects. And I also run a Alzheimer's Disease Research Center for Minority Aging. It is a program that is focused on social behavioral aspects of Alzheimer's disease and supports underrepresented scientists to do this work. So today I'm going to talk about who cares about healthy aging and why. What is healthy aging and the factors contributing to it. I'm going to review something called the California Master Plan for Aging and another entity or program called Age Well San Diego. I'm then going to talk about some of the San Diego nonprofit organizations involved in aging that you may want to partner with in projects. And then what is the Stein Institute for Research on Aging and what do we do related to healthy aging and more. So everyone seems to care about healthy aging these days, which is terrific for us. Some including pharmaceutical companies, nonprofit organizations like the National Council on Aging and AARP, companies like Altos and locally Rejuvenate Bio, and programs like the National Academy of Medicine, who has a Healthy Longevity Global Grand Challenge, and the World Health Organization, who's sponsoring a program called Decade of Healthy Aging. So this is why people care about healthy aging. It's about the numbers. So these are two population pyramids, one from 2000, one from 2020. And you can see the one on the left is more of a pyramid shape, and the one on the right is getting to be more square, and that's all due to aging. So the median age in 2000 was 35. The percentage of those 65 and older was 12.4% in the US. In 2020, the median age was 38.8, and the percentage of those 65 and older is 16.8. As of 2022, the percentage of those 65 and older is 17.3. So the numbers are really one of the major reasons people are caring, or all kinds of entities are caring about aging. So next I'm going to talk about a couple of definitions of healthy aging. One of them is from the Centers for Disease Control, and it defines it as the process of maintaining good physical, mental, and social health and well-being as we grow older. It is not just for older adults. It starts at any age. And then the World Health Organization says being free of disease or infirmity is not a requirement for healthy aging, as many older adults have one or more health conditions that, when well controlled, may have little influence on their well-being. On the bottom are three images that show this. So on the left is a group of older adults who look like they've come from a vigorous workout, looking well, happy, smiling. In the middle is a woman who's bent over with severe hyperkyphosis or curvature of the spine, yet she's out in the community getting her shopping done, managing well. And then in the third slide, we have a woman who's smiling at us and using her mobility device, her walker, and presuming she has a mobility limitation with this assistive device, as we like to call them, she can get around as she needs to. So I like to define healthy aging as really well-being. It's also known as healthy longevity or improving health span. There's a whole variety of terms for this, but it is heterogeneous, so it looks different for every person. We know this as we think about those in our lives who we know who are aging. It's multifactorial. That is, there's a wide variety of factors that influence how our well-being goes with advancing time. and it can vary over time. So sometimes we'll be in better shape, all of us are, than others. Same goes for older people. So some of the factors, these are just some, that influence healthy aging are genetics, the environment in which you grow up and live, health-related habits, alcohol consumption, smoking, going to see the doctor on a regular basis, as well as psychological and physical characteristics. So to go a little further into some of the factors that we know contribute to healthy aging are keeping active physically, cognitively, and socially. We here today are getting cognitive interaction as well as social interaction, so these can be achieved in a single place in multiple ways. Engaging in healthy habits, again, physical activity is a good one. Eating, not processed foods is another. Managing your chronic conditions, I bet probably most everyone in here has some chronic condition, which we're all here today, having managed. And then living in a safe and supportive environment, especially as we age. You want to have walkable communities. This is really for all ages, but walkable communities in which you don't have to, you're not going to trip on the sidewalk and fall because it has an uneven sidewalk, or it's a place that you feel is too dangerous for you to go out into. Having a positive outlook also matters. This can be something you learn to have, actually, if it isn't your default condition. Being able to manage stress and being resilient are some. I'm going to go into a little more depth in just a couple of these. So physical activity, why does this contribute to healthy longevity? People who exercise regularly, we know, live longer and enjoy more years of life without pain or disability. We lose muscle mass with age, that's a fact. But resistance exercise with weights or rubber bands or even body weight can help us maintain muscle mass. Exercise can be a social activity and a mental activity and improve mood, quality of sleep, your blood pressure, and more. And the physical activity guidelines for Americans from the U.S. Department of Health and Human Services recommends to move more and sit less, with some activity better than none. So that's where I tell many audiences, that's where we can start if you aren't doing that 150 minutes a week, which is the other standard, which may be difficult for people to achieve. Just getting up and moving is a positive thing. The next thing I want to talk about is resilience. That is defined by some as being able to bounce back from various types of challenges. It's associated with lower levels of perceived stress and loneliness. And one study done by Dr. Dilip Juste, who's my predecessor at the Stein Institute, and Danielle Glorioso, its executive director, developed a manualized 6-session resilience behavioral intervention, which was proven to reduce stress and loneliness, as well as increase resilience and happiness. So now they're deploying that into various senior living communities, and that's a terrific thing that they've done. And so I'd like to also point out in this slide, although the gentleman here on the top is wearing, a nasal cannula, presuming needs oxygen supplementation because he has a chronic, lung disease, that he's still smiling, still out, getting around. The woman at the bottom is getting a hearing aid fixed. We'll see more different kinds with Dr. Dadri's work. So, with that, she can engage more easily in social situations and others that may prevent others from wanting to engage because they just can't hear. So the National Institute on Aging has this infographic that I think nicely summarizes some of the healthy habits that can help us, age over time in a more healthy way. So like we said, exercise, getting moving, and any kind of exercise counts as exercise, whether it be gardening, biking, walking, pickleball, swimming, anything. Choosing healthy foods rich in nutrients, we all have known is positive for health. Connecting with family and friends or other ones that we like to engage with, like a meeting today. Going to the doctor regularly, keep track of your chronic health conditions or engage in preventive health behaviors. Learning something new is also good at all ages. So, joining a club, learning how to paint, learning how to take better pictures with your phone, all these things can be good for your brain. And then managing stress in the way that, speaks to you. Some ways are trying yoga, keeping a journal, going out for a walk in nature, anything that you like to do or can help manage stress. So this is, next slide describes to you some aspects of the California Master Plan for Aging, which has been around for probably 5 years, and they like to say California for All is their tagline. And this has 5 main goals, and they're all listed to the right of the slide, and I'll go through them briefly. So the first is housing for all ages and stages. And so one of the strategies is to live where we choose as we age in communities that are age, disability, and dementia friendly, as well as climate and disaster ready. So this is part of this. They're aiming to have more housing options, transportation beyond cars, outdoor and community spaces are some of the things that are being done to work on this particular goal. Goal two is Health Reimagined, and this is having access to services we need to live at home in our communities and to optimize our health and quality of life. Things that are going on with this are things like AI health, telehealth, other things that make it more easy to connect, using devices to connect with your, instead of the portal, which can be difficult for some people to use, other means for people to connect easily with their health provider. And then to finish it up, inclusion, equity, not isolation is one of the goals. It's to have lifelong opportunities for work, volunteering, engagement, and leadership, and will be protected from isolation, discrimination, abuse, neglect, and exploitation. And part of this is to combat all the isms, ageism, ableism, racism, xenophobia, sexism, homophobia, and expand opportunities for adults that have, all older adults and those with disabilities, to be really engaged in all ways in community. Goal 4 is caregiving that works. The aim is to be prepared for and supported through the rewards and challenges of caring for aging loved ones. This is in part learning more about training, learning how to be a better caregiver, supporting caregivers more effectively so more are able to do it, paying them appropriately so they can do it. And then goal 5 is affording aging, and that is we will have economic security for as long as we live, and that's to, in part, enable people to work longer and to have better systems of social support, social financial support in our system. So this is an ongoing plan that the state is engaging in. So locally, we have something called Age Well San Diego, which has much overlap with the California Master Plan. So their main things are health and community support, housing, social participation, transportation, and making all of these things dementia-friendly. So by that they mean making these things accessible to people with cognitive impairment, getting the community to understand what it is to have dementia and interact in a good way with people who have dementia and things like that. And so by 2023, it's thought 21% of the San Diego population will be age 65 plus. So we're already there. So it's important for us to recognize that. All right, this is a listing of some of the nonprofit organizations in San Diego that are focused on aging. Hopefully you all have had, know at least about one of them. So I'm just going to start. San Diego Oasis is a incredible senior center with the most programs you could possibly imagine. It has 2 physical locations, one down in La Mesa, the other in Rancho Bernardo. When I have the time, I'm definitely going to join one of them because of all the opportunities it has. Jewish Family Service has been a long-standing community organization in many places in the country who have all kinds of programs for seniors, helping them get to the doctor, helping with housing assistance, all kinds of programs. The George Glenner Alzheimer's Family Centers is been focused, started here in San Diego, it's now nationwide, and they started by really focusing on caregivers of people with dementia by providing daycare programs for those with dementia. So they have 3 sites in San Diego. One is down in Chula Vista, and It was remarkable. It's called the Town Square, and they took a warehouse and created a town square that is something reminiscent of the 50s and the 60s. So if you go in there, you'll see a beauty shop, you'll see a department store, you'll see a diner, you'll see a library, you'll see a town hall, you'll see a town square. There's a car from the 50s that you can tinker with, and they have all kinds of programming for people with dementia that's affordable. And the VA has a contract with them too. So we're now engaging with them in a research project involving caregivers of people with dementia. Our focus, like Dr. Brown, my personal research focuses on substance use, but in older adults. And so we're looking at cannabis use in caregivers of those who live with dementia. We know this is a thing, and we know they also provide cannabis to their loved one with dementia. So it's basically reduce stress for me, reduce behavioral problems there. It can work, they're studying it. So this is kind of thing that, again, having connections with these agencies that really work with people that you may be interested in helping or learning about is an opportunity. Southern Caregiver Resource Center is another program that focuses on those who have dementia and their caregivers. A lot of programs with them, Alzheimer's San Diego. And then Elder Help's another one that helps with housing assistance and more. And aging and independent services is something that every community has. And if you call them, they can tell you, if you want anything, that you call them and say, I need this, they will help you. Or you can go to their website and see. And then Serving Seniors is another organization that I'd like to call out. They have an incredible senior center in downtown San Diego that focuses on low-income seniors. So they provide meals, breakfast, and lunch every day for low-income seniors and provide medical services, dental services, and other services, including they have a big focus on homeless population. And Eli Spencer, who's talking here later, he's done a lot of work with them. Okay, so moving on to the Salmon Rose Stein Institute for Research on Aging and Center for Healthy Aging. Hopefully many of you at UCSD know about this entity. It's been here since 1983. It was the first aging-focused institute in the University of California. It initially focused on the diseases of aging, but in the last 20 years, under the leadership of Dilip Jeste, it has emphasized healthy aging. And then with a focus primarily on mental health, because he's a geriatric psychiatrist, is what I think is probably the reason why. And now, under my leadership and that of Anthony Molina, who's a gerontologist, we've shifted the focus to include geroscience, or the basic biology of aging that drives disease. So there's a thinking now that Alzheimer's disease, osteoarthritis, cancer all have a basis in aging biology. So if we can understand aging biology and target it, we might be able to affect multiple diseases. But it also has a piece that can be extended across from bench to bedside to community through examining drivers of healthy aging. So that's where we're kind of making our focus now. The Stein has three main things it does: research, training, and community engagement. The research we do includes some of the things here. There's something we've hosted for about 13 years called the SAGE study, or Study of Aging and Evaluation. It is a longitudinal cohort study among San Diegans, and we're now enriching the cohort with more diverse populations, because over time, those who are less diverse have stayed in the study, and those who are more diverse have dropped out. So we're going to enrich our sample now. We also have something called the Belmont Living Lab, which I'll describe in the next couple of slides. And then finally, we have annually funded pilot projects open to the entire university. Hopefully, one or more of you may have gotten one of those pilot projects to work in the general space of healthy aging. For training, we support early career investigators and other trainees from high school through faculty, mostly by partnering with existing programs that focus on aging. And then finally, community engagement, which I think is one of our strongest suits. We've had a lecture series now held via Zoom now 3 times a year, as well as an in-person symposia annually, and posted on UC TV and on YouTube. We plan also to hold in-person lectures in locations where we can engage a more diverse audience. So that's been a terrific engagement piece. And then we have newsletters that are sent out bi-weekly to more than 4,000 people. That is information on studies that are recruiting. We share research results, and we host a variety of events and more. And Sam and Rose Stein are up there in the right corner. No longer with us, fortunately. So a little bit more about the Living Lab. So Belmont Village Senior Living is a very fancy retirement community in UTC. So it's the newest of the retirement communities. It's a gorgeous facility. It's walkable from here. And in this particular program, we are partnering with older adults to where they live to develop, create, and test innovative research to improve lifelong health and well-being. The Living Lab itself is a 420 square foot studio apartment that includes desks, a kitchenette, a large bathroom. It can be used for recruitment, physical assessments, specimen collection, technology development, testing. We have other spaces for researchers in this building, including a gym, multi-purpose room, conference room, art studio, and a screening room. So it's really open for business to UCSD researchers, and I'll tell you how to access it at the end. Examples of the studies being done here are the resilience training program, like I talked about, that manualized 6-session resilience training. We have a program that's focused on improving intergenerational connections, we know is also good for health. We have also a fall prevention training program that you can see on the right. The image there is that program. Future studies we have planned for the Belmont are testing of unobtrusive motion detectors to assess and address fall risk. That's being led by one of the graduates of your School of Engineering undergraduate who now has a business called Mercury Health. We have a program with Fadil Zaidan, who is doing a project on meditation to improve brain health. And we're also working with Edward Wang, also in a School of Computer Science Electrical Engineering, I think. Is that it? Yeah. Anyway, and he is also part of the design lab. And he's developed a clip that attaches to a smartphone that measures and monitors blood pressure. So we plan to replicate this model of the Living Lab in diverse communities. That's a future goal. In certain communities, it may be better served by having a mobile van that we bring to them to do these kinds of projects. So in conclusion, or my takeaways are that the population is aging. Aging is heterogeneous. Healthy aging can be defined as maintaining function and living in an environment to enable well-being in older age. Many factors influence one's ability to live a long and healthy life. There are a number of ongoing initiatives and agencies in the state, county, city, and at UCSD to positively impact healthy aging, lots of opportunities for collaboration, and there are truly unlimited approaches to study healthy aging and improve our ability to enable well-being in older age. And last is thank you. The bottom, aging at UCSD EDU, is the email for the Stein. My personal email is on top. And then the healthyaging.ucsd.edu is where you can see our website with all the opportunities. There'll be up there where you can access the Living Lab, SAGE study, and more on that site. Thank you. Question?
Someone has a question in the moment. Perhaps we can entertain one.
Yeah.
Yeah, thank you for the great talk. You know, I'm a psychiatrist. I work in the community for San Isidro Health.
Oh.
So I see kids starting at 4, and I see patients all the way up to 89, 92. And so I spend a lot of time also in my role thinking about systems of care and how do we serve people better. A lot of the problems I see is how a lot of our systems are not working together. And I think I just want your thoughts on how do we make that happen in San Diego a little bit better for elderly,
Really
not just
ages.
Patients, but people who are maybe need more support.
Yeah, so when you say systems, you mean the health system is separate from community agencies, and agencies aren't connected with each other.
Absolutely.
And,
all the big systems, I don't want to name them because we are in one here, but including ours and a lot of, they just are not working really well together. And as you know, patients in that age group, but also in other age groups, really use many different systems through their care journey. And a lot of times in the medical field, we almost think what we do is the most important, but a lot of different pieces are being done by different organizations for the elderly, all of which is important. How do those different systems work better together?
Great question. Really hard to answer. So some systems are connected through the health record, right? So we're all connected here locally with scripts, but no others. Well, maybe some others, but it's random. It depends on if your EMR connects with us, right? UCI is big when they're connected with us. So having the ability to connect with the health record is important. Also, I think having initiatives by higher up to encourage connection. There are now some research opportunities or funding opportunities to get health systems better connected with community agencies. There's a bigger emphasis on social determinants of health and need, like that, we can give pills out or recommend physical therapy, but they may need housing support or nutritional support or things like that to make them better. So important question. We have a long way to go. There's been some initiatives to work on that, and some already exist, but yeah, huge question. Not a great answer yet.
Do you want to introduce yourself?
Yeah, sure. I'm Gaurav Mishra. I'm an adult child adolescent psychiatrist. I'm Chief Behavioral Health Officer at San Isidro Health, so we're an FQHC. We see about 150,000 patients total. My area of interest is really now designing systems that work better for our patients versus designing systems that work well for health systems, So, yeah, but I'm not a geriatric psychiatrist, but I see older adults all the time, and a lot of the work is also around supporting caregiver. That's where the real difference happens, I think, more than sometimes the patient themselves, So I think, yeah. Thank you.
Thank you so much.
This is Professor Mira Oskan. I'm a faculty member in Electrical and Computer Engineering Department, UC Riverside. Again, this is Professor Mira Oskan from Electrical and Computer Engineering Department from UC Riverside. Thank you for your presentation. And my question is about the potential impacts of, cultural influences on aging. Any practices, and are those also, part of some of the studies that you have in the center? I want to learn more about that also.
That's good. Thank you for that question. We haven't had any studies that I'm aware of that have focused on cultural practices. We are, with the SAGE study particularly, now examining more cultural influences on health that may be related to, how your culture impacts your, ability to communicate with health providers and others. But I would say that hasn't been a big part. We hope with our expanding into communities that have different cultural backgrounds that we will get better at that, because they will inform us better on what needs to be done for them. I would say there's been some attempt in various studies, and it's hard because it costs more to do studies in non-English language, non-English language, so there's barriers that way too. It's more costly to recruit participants who are not your average participant, the white high SES person that's typically part of our studies. So yeah, I think there's much more understanding and awareness of this as an important factor, especially there is, but we haven't gotten great ways to do that yet. Working with partners, though, like this gentleman, would be helpful to us. Thank you.
Fubo, did you have a question too? Very good.
So I have a question. You mentioned about exercise so critical. What do you think about gaming for senior adult? And also gaming. And this is getting very popular, but we don't see a good game designed for senior adult. I think that would be a really good way to get them connected in the community and can address intergeneration connection and help them to aging healthily. And I haven't seen a big effort at UCI. We have been doing that, and maybe we can talk about that.
Yeah, that'd be wonderful. I don't know a ton about this space. You remember the Wii? Was that the thing where you could stand on the thing and you could bowl and you could play tennis? And that's kind of out of favor now. But that was one thing they did have at senior centers, I know, and senior living communities as an activity. But individual games focus specific. There's been brain games too, which actually aren't effective for cognitive health. But I haven't seen it be a big focus. It would be good to do that. Thank you.
Thank you. Very interesting talk. My name is Fu Barao. I'm one of the employees of the QI. My question is, so I'm new to California as well. I moved from Midwest. I'm just curious to what are the advantages for people, because when people think about cost of living, right? as the I experienced the biggest, which is the biggest change to me moving from Midwest. And what are the advantages for elderly or even for me staying here? You know, for me, I can understand my career, right? But for elder, so I was just curious to what are the
so the advantages of staying in San Diego,
spending the elder,
place.
Right, exactly. So.
Yeah. Well, homelessness is on the rise in San Diego. It's thought that 40% of people who are homeless are age 55 and older, and the newest group of people becoming homeless are those being aged out of their homes. So it's a big problem. So I guess the advantage is, I don't know, weather, community. There's a huge number of retirement communities in this area, I can tell you that. It's remarkable.
Access to advanced medical care?
Yes. Outstanding medical care and other intellectual pursuits available here. What else? Excellent. I don't know. Just being able to be outside and exercise is a big plus. It does good things for your mental health, too. I've taken tests, too. And also, of course, if you have family or friends, it's always helpful to be near them as you age.
I think there's one last question. Yeah. Please introduce yourself.
Hi, my name is Anu Chinsetambal. I work at the design lab, and I am also part of the QI. I'm here to learn. I have a question on, you talked about the healthy habits and making it habit, especially for older adults. It's personally really hard for me to manage it as well. So I am curious when it comes to these older ages, what were your approaches to make it as a habit? And like, for instance, we have reminders, we have schedules on our calendars and all that. I have mobile applications that sends me reminders to do certain things. How are you approaching that with older adults, especially living lab versus at home?
So what's the last thing you said? What versus at home?
Living lab, Belmont Living Lab, for instance, and also comparison to home care.
So I would say in general, it's helpful if you like to do something, if you have a partner to do something, if you have you're paying someone to help you do something, and also if it's accessible to you, it's easy to get to, and is a thing that makes you happy. That's another good way to get a new habit. Or if it's good food, having good food available to you as the sort of default, like they had here today. They had a lot of fruit and the chia pudding and just little tiny muffins. So having the opportunity also is, I think, ways to help people make behavior change. And just it says, what does it take, 2 weeks to make a behavior change? So really trying to stick with it and maybe use the reminders and really stick to it till you sort of have it in there, that it's a thing you're going to continue to do.
Mm-hmm. And that's for in your programs with older adults?
Oh, I would say that's a general thing. In our programs, we haven't had anything like the fall prevention program is an exercise program. So that is something that I would say is helpful for, a good health habit you're doing an exercise program to help you prevent falls. Same for the meditation program that we're starting, is developing programs and continuing to engage in such programs to develop healthier habits and ways of living.
So the conclusion is that they have continuous engagement so that they get the habit going on.
Yes.
Oh, got it. Thank you.
Yes. Thank you.
Yes, thank you, Alison.
Thank you.
Thank you very much.